Good morning. I'm Bill Blackburn, Mayor of Kerrville, and we come to you this morning with another community update regarding the coronavirus and the response to that. This morning, you will hear first from Fire Chief Eric Maloney, and then CEO of Patterson Health, Corey Edmondson, and then Director of Kerr Economic Development Corporation, Gil Salinas, and then I will come back for a wrap up. Chief, if you would tell us about it.
Thank you, Mr. Mayor. Citizens of Kerrville, quick presentation, talk a little bit about the numbers that we have for this last week. Next. So we're definitely seeing a change in the numbers that we have for the number of active cases. Remember, if you'll remember back in January on the 14th, we were almost at 500 active cases. And then since then, you can see the steady decline. Now in February 25th, we're down to 99 cases. However, I say that cautiously because we're still at 99 cases. That is still high overall compared to where we were back in October. And we need to be aware of that change, but that doesn't mean we need to change what we're doing. So continue on this track and we can bring those numbers down. Down below, you'll see the lower line there. In the beginning of January, when we started off, we were at 31 people that were hospitalized at Patterson. And so that's a very high number of individuals. That really kind of kept there through January. Even at the end of January, we're back at 30. Now we're down to 8 or maybe a little bit more. I'll turn that over to Mr. Edmondson as far as the numbers, but that's a better number. But still, we have to be careful and cautious of what we see out there, continue to do the right thing moving forward through March, and then we can hopefully see these numbers drop even more. Next. So one of the things I saw you said before was in regards to the Cedar Fever, and now that cedar is starting to go away a little bit, now we're seeing more of the seasonal allergies of trees will start to bloom here, especially after last week. So we'll probably see some more changes there. So more allergies or season allergies are going to kind of come up. And so now it's also important to identify there's very common symptoms between the two, and there's also different symptoms between that and COVID. So it's important to understand that when we talk about COVID, more common with COVID, fever, chills, muscle and body aches, that loss of taste or smell, nausea, vomiting, diarrhea, that's not allergies. That's more symptomatic with COVID, as opposed to allergies. You'll see itchy or watery eyes, sneezing, and then those common symptoms, cough, shortness of breath. That's that if you get those more with the grasses, fatigue, headache, sore throat, congestion, or runny nose. So do be aware. So we do have testing available. Next slide. And we have testing options still available here in Kerrville at Patterson Urgent Care. So 1740 Junction Highway. So you can still make an appointment over there for symptomatic. We still have Patterson Medical Associates on Bandera Highway. So you can call the main number at 896-4200 for Patterson to make an appointment. And then Franklin Clinic is still providing testing over there. They have an online calendar that you can use to pre-register. And then we're working on getting a free public testing in March. And when that date does become available, we'll get that posted for the public out at the Hill Country Youth Exhibit Center. And that's that week-long testing. So we will provide more information with that. Next slide. So let's talk about the vaccine for Kerr County. So we're confident we're the healthcare workers that 1A. So we have vaccinated the majority of those in Kerr County that wanted that vaccine. And so really the focus now becomes on the phase 1B. So as before, one of the challenges we have in Kerr County is that there's currently, according to the Department of State Health Services, 14,000 residents are 65 plus, and then 14,000 residents are also 16 to 64 with a medical condition. Any of these medical conditions qualify you in that phase 1B: cancer, chronic kidney disease, COPD, Down syndrome, heart conditions, organ transplant, obesity, pregnancy, sickle cell disease, and type 2 diabetes. So other ones too, when we talk about the pre-registration process for that, is to make sure that a clinician will evaluate if you have a condition outside of these, that would also allow you to be in that phase 1B. Next slide. So according to the Department of State Health Services website, so in Kerr County, about 5,000 people have been vaccinated with at least one dose. Out of those, 1,900 people have been fully vaccinated. So, so when we look at the numbers, so this is according to the Department of State Health Services, these are our citizens or people that reside in Kerrville. They may have gotten the vaccine somewhere else, but these are the numbers that are currently presenting. We still have the information in frequently asked questions call center available. That is 830-315-5900. And so that's still available for individuals. The Patterson Medical Center vaccine pre-registration is available at 1-800-208-3611. That number is for individuals that cannot register online. If you can register online, I encourage you to go to the www.research.net/r/Patterson Health, and you'll be able to fill out a form. And that's where you'll have that opportunity. If you have another health condition, that you can actually put it in there and a clinician will evaluate that process. However, you are pre-registered, that's how you will be notified back. So if you do it via the email, you will get notification of that pre-registration process. They were also working through and a process to notify you that you are not on this week's. So we will use that list. Patterson will use that list for the next 500 that they're going to do off that list, and try to notify those individuals that you did not make this 500, so you don't have to feel like you're always in wait for that. Next slide. So I encourage you to learn about the vaccine. So if you still have questions and unsure if you want to get the vaccine or not, I encourage you to learn about that. There is great education information at the Department of State Health Services website at dshs.texas.gov/coronavirus, and you can learn more about it. You're also going to see some information on there, not just for the Moderna and the Pfizer, but potentially next week you'll see some for the Johnson & Johnson. So you can learn about your options for the three that we're hoping is available come next week. You can also find information on where to get vaccinated. So more information is on there of the different hubs across Texas. All the vaccine providers, they have the phone numbers, they have other ability to contact that with the interactive maps. So you can get on other sites too. And we do encourage that. So to register with other sites. We ask you to please be patient, be kind. Our priority is to protect our community and your loved ones as we move forward and see more of these vaccines become available. Next slide. Mr. Mayor, thank you.
Thank you very much, Chief. Let's go now to Corey Edmondson, CEO of Patterson Health.
Good morning. Thank you, Mayor. I feel like I've got a lot of things to kind of share with you this morning, so you may think that I'm just kind of clicking through things. So stay with me as I go through this. First of all, I'll tell you that our nurses are continuing to stay positive in light of we still have COVID patients, and they've obviously been inundated, but we just talked about how there was a downward trend. We continue to stay positively Patterson in all that we do. But I will tell you, since March of 2020, so when this thing hit Kerrville, we saw our first patient. Patterson Health has spent $5.2 million in costs that normally we wouldn't spend on things. It is strictly related to COVID. That's buying equipment, that's buying supplies, extra supplies, it's staffing, adding staff to our protocol and things to be able to do this. But I just want to give the community a perspective as to how much money we've spent to date strictly on COVID cases. And that's just coming out of our bottom line as an organization. We're weathering the storm. It certainly doesn't help us financially, but it's the right thing to do. And that's what we've done. There's been a downward trend in hospitalizations, like Chief Maloney said. Today, we have 8, as he said, 2 on ICU and 6 on our medical floor. That's fluctuated a little bit in the last few days. We've seen single-digit hospitalizations, and knock on wood, we hope that continues. But Also, last week, we were double digits in some areas. We had 13 at one point in the hospital, but that's certainly a huge trend downward compared to our 36 that we had as recently as December and January timeframe. So it's huge. We think that the vaccine and other things that we're doing are making an impact there, and we hope it continues. Another positive trend is the overall positivity rate of those who are being tested, whether it's they think they're symptomatic or they're asymptomatic. But those who are being tested at Patterson, our positivity rate, to give you a perspective, back in early January, we were at 27%. So 27% of the patients tested were positive. Late January, we were at 16%. The month of February, we are down to 9% positivity rate. I tell you that to give you some perspective as to things are looking better, but that doesn't mean to quit wearing a mask or not washing your hands or doing all the things you've done to date. That's just to give you an idea that, hey, things are moving in the right direction. We're not out of the woods yet. And I will tell you that I believe COVID will be around for as long as we all live. It's just, we're just gonna have to plan on mitigating it and managing it. And from that perspective, I believe it'll be just like the flu, and we'll manage it, but we'll be better prepared moving forward. So it's not going anywhere. The therapeutics that we use called the MABs, M-A-B-S, or bamlanivimab is another word for it. There's other MABs. They're all therapeutics that end with MAB. We were doing 12 a day. We're down to 3 a day. So that's another downward trend. So let's talk about vaccinations really quick. Chief Maloney talked about our pre-registration site that we opened up several days ago, well over a week ago, and had positive response to that. Thank you for signing up. Those are being filtered based on 1As, which are healthcare workers, and 1Bs with comorbidities and all the things that the state stipulates that we need to filter that. That software and clinicians filter the number of people. When you pre-register, you do get confirmation that you're on the list. And if and when we get the vaccines and you fall into one of the vaccine categories, we will notify you. So there are over 5,000 people who have pre-registered. Keep in mind that we're getting vaccinations hopefully on a weekly basis. So this week we did a mass vaccination clinic yesterday. We vaccinated 500 yesterday, and we're successful with that. We actually had some people who did not show. They canceled or just a no-show. So we were calling people who are next on the list. Thank you for being flexible, community, and saying, you bet, I will be there, I'm on my way. We're letting you know in advance when your appointment is. And then and obviously if people don't show up, we're calling people at the 11th hour, and we were very successful with that yesterday in getting people in. The pre-registration site, you'll be notified when you're up. You're on the list. So when you complete that pre-registration, you can affirm that you're on the list. If you're wondering if you're on the list, know that you're there if you got the confirmation at the end of the registration. Next is another positive thing. We just got notified this morning by the state that we're receiving another 500 vaccinations next week. And we plan on hosting another mass vaccination clinic next week, and that's Friday. So over the next few days, be looking at your email to find out when you may be on that list to be vaccinated. And please know that we're going to get that out. If you're not getting an email, you're not getting confirmation, that means you're probably not on the list. Just be patient with us, and you'll get confirmation of that. We've been overloaded with phone calls, people wanting to know, am I on the list? Am I getting the vaccination? When are we getting the vaccine? I will tell you, we don't even know when we're getting the vaccine. And when we do, we let people know when they're on the list to receive that. We're also hosting a second dose vaccine clinic next week as well. So the number of people who are fully vaccinated that Chief Maloney talked about, that will move up in total cases vaccinated in Kerr County. We still continue to communicate with the state and lobby for more vaccines. We continue to do that, and we believe that has had positive effects, and where we're getting another round of vaccines locally in Kerr County. J&J, Johnson & Johnson is going to the federal government for emergency use authorization today, and we hope this weekend there'll be validation that J&J gets emergency use authorization. And so we hope that we would have the J&J vaccine, not next week, but the following week is when they'll first start distributing Johnson & Johnson. And let's see here. Chief Maloney talked about the website. You can go to our website and register and do the pre-registration. You go to our website, go to the COVID Information Center. It takes you to another site. And up there at the very top, you'll see something called COVID-19 Vaccine Pre-Registration Sign Up. You can go and pre-register there. The one thing I want to make sure that people are aware of, please get care. Again, I've said this before, we are having more people expire or die at home. And I don't want to be morbid here, but it's a reality of what we're experiencing. People are not reaching out to 911. They're not reaching out to their doctor when they're not feeling well. They're scared to go in for fear they're going to get COVID. You're not going to get COVID by coming into the hospital. We're one of the cleanest places. You're not going to get COVID by going to the doctor. Please get your care so that you can have good health moving forward. We've been in this a year, and if you continue to prolong that, you're just going to get worse. So please receive your care. I will tell you that the hospital received for the third time in a row what we call Leapfrog A safety rating. That's one of the safest ratings you can have as an organization in healthcare. We received that again. So we're one of the safest hospitals in the country when it comes to healthcare. I would be remiss to talk about really quickly Winter Wonderland last week, and I'll wrap up with this. At Patterson Health, not only were we continued to be overwhelmed and inundated with COVID-19, but we then got overloaded with care with last week. Our staff did a great job. We were saving lives. We were working with the EMS, Chief Maloney's group, and we were rocking and rolling. It was fantastic coordination between the organizations. We were finding shelters. We were taking people to shelters. We were relocating people whose power went out. It was phenomenal. Our home health agency, Patterson Home Health and Hospice, they were helping with the EMS and transporting patients. We were oxygen-dependent patients who lost power. We found them a way to get to the VA for what we were calling an oxygen-dependent shelter. We thank the VA for working with us. It was great coordination in emergency management. You should be proud of your local joint operations and emergency management structure. We performed well. Of course, we've had practice over the last year with COVID. It was great work. We were having staff sleep overnight here for 8 straight days because some people could not make it into work. So people stayed extra because they were afraid they might not get back to care for our patients. We hit a record number of census of 122. We're a 124 bed licensed hospital. We hit a census of 122. So we were maxed out last week, but we still performed well. We didn't transfer anybody. We got people in, we got people out. The EMS helped us do that. We put our surge plan in place, and we were able to be very successful last week. I'm proud of the staff. We couldn't have done it without their energy and effort and willingness to do whatever they needed to do to make us successful and take care of patients. So thank you, Mayor.
That is a great and interesting report. Thank you very much, Corey, for that. And now let's go to Gil Salinas at the Economic Development Corporation office.
Thank you, Mayor, and I'll echo what Corey said. I mean, he couldn't have said it better. The interagency collaboration in our community was, I mean, one of the best that I've seen, and I've worked in different communities, as some of we all have, and Chief Maloney as well. I mean, it was pretty impressive. So that being said, let me start with some local economic indicators. Our unemployment rate, we are at about 5.1%. We're still about 1.5%, almost 2 points above normal for Kerrville. This was for the month of December, but we're still well below the state and the national average. We expect those numbers to drop here in the next few weeks, and it's going to be primarily due to this winter blast that we had. There's going to be a lot of people. There's a lot of people working right now in construction, getting hired in construction, hardware stores, plumbers, electricians, carpenters, and that trickles down to some of the into the retail sector. Now, about the winter blast and the problems that have been associated with it, because the entire state has been declared a disaster area, there's a lot of money that's going to be coming our way, specifically through FEMA. And keep in mind that some of these PPP loans for COVID funds are still out there. So for more information, you can go to KerrvilleTogether.com, which is something that we enacted back when COVID hit almost a year ago. Can't believe that. So again, my advice, no different from last year to this time around with this disaster that we had. Put in for everything and anything. I mean, it's just as simple as that. That money's out there right now. Moving on to some of our project activity at the KADC. Gulf Avionics, that is a major aerospace firm out of Dallas. They announced a couple of days ago, they announced this week that after a year-long search, they have decided to locate their headquarters and MRO operations at the Kerrville Airport. And MRO, that's maintenance, repair, and operation, which is just kind of a big deal. Over the next 5 years, this company, they're going to be creating upward about 50 jobs, paying $75,000 in average wages. Capital investments about $1.5 million. And they're going to be the skill sets for some of their employees that they've already started hiring is a medium to high skill sets. So those are the workers, the skill sets that we want for our community. So this is going to be a great boon to our economy. Again, bringing dollars from the outside in. And in the last few weeks, we've already facilitated a discussion between Gulf Avionics, our newest corporate citizen, and Killdeer Mountain Manufacturing, which is our other big project from last year. And we're already starting to see how they're collaborating, communicating, and seeing some of these synergies being created. And wrapping up here, I will say that the benefactor of all of this activity that we're starting to see is going to be our local suppliers, our vendors, our small businesses, those businesses on, Main Street, the ones on the periphery of downtown and outward, the businesses that depend on people's disposable income. That's what these companies do when they come in. They just start creating more. That outside dollars coming into our community is just more disposable income for our people here. And the other benefactors is going to be our local workforce, and then our talent, which is two very different sets of groups of individuals. So now we have a real opportunity, in addition to what a company like Killdeer is doing, at the retaining some of our young talent, some of our kids, creating a more diverse pool of workers for our area. So that process has begun. And ultimately, everything that's happening with this company coming in, again, just adds, it's aligned with the 2050 vision plan, and all in the name of creating a more resilient Kerrville economy. That concludes my report. Back to you, Mayor.
Thank you, Gil. Appreciate it very much. Let me mention several things in the wrap up. It was 347 days ago that I declared disaster given the coronavirus. Oh, my phone is going off. Sorry about that. I declared or made this declaration of local state of disaster. A local state of disaster is hereby declared for the city of Kerrville, Texas, pursuant to section 418.108A Texas Government Code. So we are 18 days away from a year of having proclaimed that disaster. And I quoted this one time that I felt like at some point along the way, we're kind of like the kids in the back seat on a trip saying, are we there yet? And I think those that you've heard today have said, we're not quite there, but we are getting there and we are making progress. To me, an incredibly important word in this in regard to our community is resilience. That we have resilience, strength to stand up, and deal with this. But now the other factor is resolve. Resolve to actually get this done and to wrap it up. A couple of things I would mention. There is another vaccine coming out, as has already been talked about, and that's great. Also, at the federal level, they have gone beyond the vaccination hubs to go directly to the large pharmacies with vaccines. And we're going to begin to see that, which will then increase the total number of vaccines we have in the county. I want to say, as we have a number of times through this, please do business with local businesses. Yes, wear a mask, social distance, don't be out in a crowded environment, but do business with our local businesses, including restaurants. One other thing that I want to mention, given the COVID fight, given last week's winter weather, all of this begins to take a toll. I want to give you a telephone number if you need it, and that is the local mental health hotline, and that is 830-792-3300. 830-792-3300. And that's the mental health services located in one Shriner building. But if you are feeling very stressed, if you are getting too low emotionally, if you're dealing with some things, please reach out. A moment ago, Corey Edmondson said we're seeing too many folks just not reach out in time for the help they need. And that had to do mainly with medical, but it also has to do with mental. So do not just let it go. Get out there, make a call, get in touch, and take care of yourself. Thank you very much for listening to this, another community update.